One patient who was unable to deal with a COVID-19 diagnosis died by suicide. The disclosure from Head of Psychiatry at the North Central Regional Health Authority, Professor Gerard Hutchinson, during Monday's Ministry of Health press conference.
To the individual who committed suicide was in fact a patient who had been diagnosed with COVID-19 and who had been admitted to the new NCRHA hospital, and in being unable to cope with the diagnosis had jumped from the third floor at that hospital.
Professor Hutchinson said the North Central Regional Health Authority has had to adapt its stress relief center to include more mental health support services as issues increased by 40% during the pandemic. Some of the concerns raised by people who visited the center include domestic violence issues, financial issues, managing uncertainty, and isolation. He also revealed that increased suicidal tendencies are being seen among one of the country's most vulnerable groups.
COVID-19 have engaged in attempted suicide and have had to be admitted to hospital for this reason, particularly among the elderly population.
Although he admitted that the population has been resilient, he said activities such as exercise, meditation, and yoga can help to manage the psychological difficulties associated with the pandemic. There are 25 new active COVID-19 cases, bringing the total number at this time to 737. In Monday's clinical update on COVID-19 in Trinidad and Tobago, the Health Ministry indicated that 28 persons are in step-down facilities, 158 are in state quarantine facilities, and 642 are in home self-isolation. There are now 43 COVID-19 positive patients currently at hospital. The number of COVID-19 related deaths to date remains at 115.